In this fiscal year, government is prescribing the remedies for a healthier Jamaica. 5 critical areas of public health are being treated.
We are working to improve patient care. This year, we intend to add 4 additional hospitals and related health centers under this program, which is extended opening hours, extended services, and triaging from the hospital accident and emergency to the health center in order to get prompter service. Under this program, the filling of prescriptions for public patients is outsourced, as we had committed, to private pharmacies. We expect some 50 pharmacies to be on this program during the course of this financial year. The drug-served pharmacies are also introducing several initiatives to improve customer service. These initiatives are currently in effect and will expand in the current financial year. I have taken the responsibility on to focus on how we deal with complaints, both lodging and solving, during the course of this year by appointing a client's complaints overseer. And I'm expecting to discuss and hopefully solicit the support of the Cabinet for introduction over the next couple of months of a compassionate care and volunteerism policy to support the empathy that is necessary as we administer to our public patients. All outpatient services have been relocated, and we are seeing up to 600 patients each day from locations other than the main building that is under investigation and repair. Most of the supporting services like lab services have also been relocated and are operational. We have selected now a contractor to do the redesign, the assessment and redesign of the new vent system to be put in place. We will embark over the next 2 years on a major overhaul of our current health infrastructure. The obvious one being the upgrading of the Cornwall Regional Hospital. Number 2, technical scoping work to be done on Spanish Town, St. Anne's Bay, and Mandeville hospitals with the view to progressively upgrading these facilities from Type B to Type A hospitals. Technical and scoping work on Maypen Hospital to upgrade from a Type C to a Type B hospital. The commissioning by June this year of the Linear Accelerator or Cancer Treatment Center at Cornwall Regional Hospital, and by the first quarter of 2017, a similar facility at St. Joseph's Hospital. The construction that we all know about of the Children and Adolescent Hospital in Western Jamaica. We're also looking at a public-private partnership arrangement for the construction of the Ministry of Health corporate headquarters. In addition to those major projects, we will immediately embark on a number of smaller but important projects that are critical to efficient functioning of many of our institutions. It is our belief that the government has a responsibility to ensure that no Jamaican who cannot afford health services is left to die for a lack of access to such a service. The truth is that healthcare is not free. The question is, who pays? That's the National Health Insurance Scheme is an appropriate response to what some would argue the impracticality of a literal interpretation of free healthcare. Consultants from the WHO and PAO have generated a first report looking at the options. We are now in the process of recruiting another internationally experienced consultant who will work with the committee that has been established to drive the deliverables of this scheme. We are moving ahead with the reform of the health system. The process of restructuring the health system will, among other things, provide data on human resource requirements, will guide the public sector reform process regarding the needs and appropriateness of human resources for the health system, including future requirements for health professionals. As a country, we have done well, and we should be proud of training of our healthcare professionals, but frankly speaking, we have been victims of poor retention. Our nurses are the most recruited internationally, resulting in a crisis in service delivery. The only option that is available to us is to collaborate with other jurisdictions in the training process. We're in discussions right now with the United Kingdom government on a collaborative effort between both countries for the training of specialist nurses. And simply put, what it would mean is that we train for some time here, they go to the UK for additional time, primarily on the clinical side because the UK has the hospitals. And at the end of that process, we both benefit from the value that is created by that trained nurse in that they can work in both locations. We have taken a decision, the cabinet, to allow for an additional 300 posts to be established for specialist nurses